Knee osteoarthritis, or degenerative joint disease, is not a diagnosis that means that everything you want to do and be is completely over. However, it's also not a great thing, and it needs to be managed, but it's kind of a given. If you live long enough or play hard enough, changes in your joint are going to occur. When we think about continuing the activities we want to do as we age, as well as maintaining our independence, movement is the key to keep us going. And that's the same thing with knee osteoarthritis. Movement is key to keep it from progressing as fast as it has been, and also getting you back to the things that you want to do. When we talk about rehabbing and working through knee osteoarthritis, it's important to remember that discomfort does not equal damage. If you go out for a walk and it's a little uncomfortable, that doesn't mean you damaged anything. It's also important to remember that just because you have signs of osteoarthritis does not mean that that's your pain generator. A lot of times when we're working with patients, we find that the fact that they haven't been doing activity, that deactivation has caused weakness and caused stiffness in the joint, and that's more responsible for the pain that they're feeling, and that pain is also keeping them in a fear avoidance to getting back to the things that they want to do. Today I'm going to go over some strength exercises that's going to help you get from where you are to where you want to be, or as close to it as we can with as little pain as we can. That may be walking, that may be skiing, that may be hiking, playing pickleball, whatever it is. We're at a spot to where we can't do those things the way that we want to. We want to try to get as close to that as we can. Now, this isn't an easy process. It's going to take some time. There will be some discomfort, but remember, discomfort doesn't mean any damage, and it takes consistent effort. The thing about degenerative joint disease and osteoarthritis is that what you have is what you have. It's not going to go away. We can try to slow it down so that it doesn't limit your range of motion anymore, but what's there is there, and you have to manage that. So as we progress through these strength exercises, start with the first ones. See how that feels, gradually progress through. Rushing doesn't get us anywhere any faster, it actually makes things slower. So spend some time on each exercise, and as you get better at them, add some resistance, and then progress through the movements. But in the meantime, we want to try to maintain as much walking, biking, or swimming as we can to make sure our whole body moves well. Our first exercise are going to be quad sets. This is a simple exercise to get our quads activated, getting a little bit of range of motion through our knee. You're going to set up on a bed on the ground with something about the size of a foam roller underneath your knee. From here, we are just going to contract the quads, bring our leg up, and hold for a 3 to 5 count. The whole time we're doing this, we really want to try to squeeze and contract the quads. Building strength here is going to protect our knee. Our second exercise is going to be the bridge try. We're going to try to get some activation through our glutes, through our hamstrings, and through our adductors so that we're supporting from the hip down to the knee all the way around. So the first one is going to be your basic bridge. You're going to lay flat on your back, feet flat on the floor, push your hips up to the ceiling, and then hold each at the top for a 2 to 3 count. The second part, we're going to take a block or a roller or something between your knees, and we're going to continue to do the bridges, but we're going to squeeze at the same time. This is going to work on the adductors. And the third one is the hamstring. We're going to take our feet a little farther away. We're going to push our heels down into the ground and continue to do bridges here. These are a little harder. You may not be ready for these yet. If you're not, work on the other two. The banded total knee extension, or TKE exercise, is a good progression from the quad sets. We're going to take a band, put it to something sturdy in front of us, wrap it around our knee, take kind of a half to quarter lunge stance, and with this back leg with the band around it, we are going to push back and straighten that leg. So we're activating the quads again, this time with a little bit of resistance. And with this one, you can go down into as much range of motion as you can tolerate. And then as we push back, squeeze those quads, hold for a 3 to 5 count again. As you get better at the exercises to activate the quads, adductors, hamstrings, and glutes, then we want to start bringing in isometric holds. This is going to really target our knees, get them nice and warmed up, while also working on the tendons on either side of our knee. With the wall sit, ideally we want to get down to where our thighs are parallel, but many people are going to have to start here, and that is okay. We want to get to where everything is contracted around this. We feel a little bit in our knees, and then we want to hold for about 10 to 15 seconds, eventually building up to 30 to 40 seconds. As you get better at the wall sit, you can continue to do that. I put that in my warm-up and a lot of my workouts a few times a week. But as you get better at that and you want to do something a little bit more challenging, a lunge isometric can be your next progression. And that's where we take a lunge position and then we go down and we hold where our back knee is not on the ground. Again, you can modify this to the range of motion that you can handle comfortably. The nice thing with the lunge isometric is as you get better at this, you can hold for a longer time, or you can grab some weight and hold that at the same time. As you get better at isometrics, it's time to put in some movement. You've probably realized that stairs are some of the most challenging things to navigate when we're dealing with knee osteoarthritis. So we're going to start working on that. We want to work on our step downs first and then eventually our step ups. So with the step down, you want a step that's maybe 2 to 4 inches, and then we are just going to work on the knee coming down, getting our heel to the floor, and then pushing back up. As you get better at these, you can stack the step higher so you get more of a knee bend, or like with some of our other exercises, you can add some load. And then our last exercise in this series is going to be the loaded step up. This is just like taking the stairs at home, but when you do that, I want you to focus on bringing the leg up, pushing down, and really pushing through this leg here, and then coming up and back down. As you get better, we want to get up a higher step, going 6 inches, and then eventually a foot if you have access to that, and then adding resistance.